Yeah, a caregiver walks a really tightrope. Yes, my husband has dementia, and it's been 9 years now, and he is where I would say still moderate dementia. He still has tremendous social skills, but he has a temper, and we have sundowning situations after 4 o'clock in the afternoon where he gets very angry and very. I think basically what the problem is he's worked all day to keep it all together. He's home and I don't have to keep it all together anymore. And he just, and it's tough. Living with him, he's living with dementia, but I'm living with him, and he takes his frustrations out on the world, and I'm his world. I've had my challenges. I've had a burnout, caregiver burnout last Easter. And the coordinator of the support group, Sandy, she recognized it and paved the way for some help for me. And she called me daily for 2 or 3 weeks just to make sure that I was getting help and making sure that I was seeing the doctor and was on medication myself. And I could talk to her because I knew her. It wasn't like it was someone that I didn't know or a stranger calling. I wasn't all that impressed with her sending Coast into me because that involved, it was like a crisis outreach program which involved someone from the Mental Health Association, but also a plainclothes policewoman. And some of those questions are really difficult. Was I suicidal? Was I about to kill my husband? They were concerned about domestic violence. Yes, we'd had some issues. But I didn't think it could ever escalate to domestic violence. But hey, they could see that it maybe could. So I needed to hear that. So that I, could put together a plan. If it gets too violent, I would now know what to do. Leave the house, or leave the situation. Call 911. Have the police in and this kind of thing. So. You never know with dementia if the violent outbursts are going to turn personal. It's been close quite a few times, but you need to have a plan in place and not think, it never happened to me, because it could. People don't understand dementia, and many people are afraid of it. And the only people that truly, truly understand are people that have gone through it. And I have made some tremendous friends there as a result of going to the support group. And we talk about all kinds of different subjects currently as to where I am with my husband who has dementia. And some people are, further ahead or further behind or whatnot, and I can maybe be a guide to someone who's just come in for the first few times. But then there's people who've had to deal with heavy duty issues, including death and grieving, and and we give each other support all the way through. It's been tremendous. I don't think I would be able to cope as well with the situation if it wasn't for the support group and the people in the support group. I think it has made me look at myself, and also look at myself before dementia and look at myself now with dementia in my life, and made me understand the process and the journey that my husband's going through and how I can help him without being nasty and without nagging, how I can help him help himself, because he's still at the stage where he wants to have control of his life, and I can't take that away from him at this stage. And I feel Acclaim Health have helped me deal with some of these issues.